Senator, good to have you on the program. Thanks so much for joining us.
Maria, thanks for having me.
Your reaction to this revised bill?
Well, I think it's an improvement in one area that's very important to Ohio. We have expanded Medicaid in Ohio, and it's incredibly important, particularly right now with our opioid epidemic, the heroin prescription drug epidemic. About half the money in expanded Medicaid is used for mental health and substance abuse. So I was very concerned about the first draft, as you know. A number of us were. The second draft is better because during the transition period between now and 2020, it does provide for people to stay on that expanded Medicaid, which is critical for Ohio and other states that have expanded. But I still have some concerns because we don't know what the numbers are. You know, we don't have a Congressional Budget Office analysis of it, so we don't know how much it costs. We don't know how many people are covered. There's still a lot of information out there to be gathered.
Well, one thing that I think we all love about America is the fact that we can debate things and, go back and forth and have a real smart debate about what policy should look like. But at the same time, Senator, your team has about, 18 months until the next major election. Are you going to be able to get everybody on board and unified to actually create and pass legislation within the next year?
I hope within the next couple months. I was one who thought we were moving too fast at first because we were talking about the end of January. This is complicated stuff, as we have all learned. And as I've said from the outset with this debate, I mean, look, it's a system that's incredibly complex, but it's not working now. The status quo is not acceptable. If you look at what's happening under the Affordable Care Act, around the country, you have about a 25% increase in premiums year to year for the exchanges. In Ohio, it's been higher than that at times. We're up to a 91% increase overall over the last 5 years. So that's not acceptable. For small businesses, it's been 82%. And yet people have not been able to keep their own doctor and their own plan. And this is, counter to all the promises, including a promise that it would be less expensive. It's more expensive, $4,600 per family. So the current system is not working. It's not working for the people I represent. We do need to fix it, but we got to do it carefully because this affects people's lives in very fundamental ways. And again, one of my focuses has been in Ohio, we have this expanded Medicaid that is critical to covering people who otherwise would not be getting health care. They'd be going to the emergency room or not getting health care coverage at all. So this is something that's got to be done right, and I think it will be, and I hope it'll be done in the next couple of months.
I guess what I'm asking is, do you feel that all of the members understand you have a window to be unified and pass legislation? You're not always going to get everything you want, and I know that some of your colleagues are still pushing back. It's time for the GOP to get together, right? Because there's so much riding on this repeal and replacement. If this doesn't go as planned, tax reform gets backed up. Other things get backed up. Next thing you know, you're in the 2018 elections.
Yeah, it would be better to move on tax reform this year as well. And again, I think that's very possible. As you know, I'm very involved in that process, and I'm hoping we can fix a broken tax code as well. But we've got to get these things right, Maria. It's important that we do have a careful analysis. For instance, not to have a Congressional Budget Office score, to not know what the costs are, to not know who's covered, how much these changes will change people's lives is obviously something that needs to be done. So it's going to take a little while to do that, and we should take the time to do that. So someone told me recently that the House is expected to mark up this week, and yet they're not going to have these scores. I can't even do the analysis. We've asked the state of Ohio to do their analysis, of course, because I want to know what the effect's going to be on my state. So we got to do it right. And if we get this right, it's going to improve people's health care outcomes as well as lower the cost of health care. And that's critically important right now.
I want to ask you about tax reform in a minute, but let's hear from business for a second, because earlier in the program, I spoke with the CEO and president of Eli Lilly, David Ricks, and asked him what was most important to him when it comes to health care reform. Watch this, Senator.
Of course, we're all for rolling back taxes on innovation, and that's really one of the principles we'd like to see is a healthcare system that rewards innovation, that encourages people, not discourages them from using the newest medications. And unfortunately, Maria, in the Affordable Care Act, medicines were very expensive for some of our poorest citizens.
What about that, Senator? Do you think this new bill levels the playing field in terms of innovation?
Yeah, it helps with regard to what he's talking about, because there is, a repeal of 19 taxes, including taxes on what they're doing in terms of their research, also taxes on other aspects of innovation in the healthcare system. So that's part of the Affordable Care Act repeal, is to say, okay, these taxes that ultimately get paid by all of us and increase the cost, as you said, of what we're receiving, whether it's healthcare services or whether it's pharmaceuticals, that is out. So that's part of the repeal part of this. And then the question is, what do you replace it with? And you know, where do you get the funding to be able to have adequate replacement to ensure people who are now getting coverage and who need it badly and who we want to have coverage? We don't want folks to be going to the emergency room for their health care. We don't want people not to have a primary doc where they can help on their prevention and their wellness. So that's the challenge here. But no, I think he's right, and I think you know, he'll therefore be happy with some of the changes that are coming with the Affordable Care Act repeal.
So you're also working on the tax reform package. How important is it to you to raise revenue while also cutting taxes? I refer to the border adjustment tax or a reciprocal tax, some tax that your colleagues are talking about to raise $1 trillion over a 10-year period.
Well, you and I have talked about this a lot in the past. In fact, you know, it's been a decade while we've been going back and forth on how do we get the tax rate down so that we can stop losing jobs and investment overseas. To me, that's critical. It's critical that we bring back the money from overseas. As you know, there's probably $2.5 trillion that's locked out overseas that can come back if you have not just a lower rate, but a different kind of an international tax system called a territorial system. That could be a huge boon to the economy. Think about that, to have that funding coming back, investing in jobs and plant and equipment. And with regard to the rate, we now have the highest business rate, as you know, in the entire industrialized world, which is driving jobs overseas. And on the individual side, it's incredibly complex. We have an opportunity to simplify the code and to give the economy a shot in the arm. Every economist who looks at this says it's pretty easy to figure out a way to take this tax code and to make it more efficient for our economy and therefore to give the economy a boost. And I think that's the critical element right now. There's different plans to do that, but the key is let's not lose sight of the objective here, which is to have a pro-growth, simpler tax code that'll give everybody more opportunity and increase wages, which is a significant part of the tax reform plan that we're working on. All the analysis shows it's actually going to help in terms of one of our big problems right now in our economy, which is flat wages.
So the bottom line is you would endorse cutting taxes without being forced to raise revenue while doing so?
Well, I think we can do both in the sense that if you have a dynamic score of a good pro-growth tax reform policy, it's going to show more revenue is going to come in from growth.
Right.
And I think that's, given our climate right now of, you know, a partisan climate where, you know, we've got to figure out a way to come together as a country, and given the fact that we're $20 trillion already in debt and $28 trillion in the next 10 years, we do have to worry about the deficit. But I think we can do both because, again, there's so much potential here to improve a broken system. We have the opportunity to put something together that will actually increase economic activity, and through that, you're going to get some revenues. But we need a good so-called dynamic score. It's a macroeconomic score that just takes into account what the effect's going to be on this tax code on the economy and on people's behavior. I think that's fair.
Real quick, Senator, it looks like Hawaii is going to be pushing back. They're filing a lawsuit against the president's new travel executive order. What's your take?
I haven't seen what the objections are. I objected to the first travel ban, as you know. It was not vetted. The extreme vetting was not vetted, and I think that's clear. And they have resolved a lot of those issues. So permanent residents are no longer covered. They're giving people time to complete their travel, which only makes sense to me. And they're focusing on, you know, the fact that we need to improve the vetting and have this ban be a temporary ban while we improve the vetting, and then get back to the regular order where we have a better system and a safer system. I'm on the Homeland Security Committee. There's no question we can do a better job vetting individuals coming into our country. So this is an improvement from the last one.
All right. We will leave it there. Senator, it's good to have you on the program this morning. Thanks so much.
Thanks, Maria. Always great to be on with you.
And to you, Senator Rob Portman there.